Sarah Boone had a plan, a twisted little game. Jorge never saw it coming, but she knew just the same. In the darkness of the night, with a smile so sly, she whispered, "Let's play a game," and he didn't ask why. She zipped him up tight in the suitcase of love. No air, no light, just the stars above. He thought it was a joke, just a lover's embrace. Sarah, he cried in that tight, dark space. Jorge was laughing, but his breath was thin. The walls were closing in as the fear kicked in. He called out her name, but it echoed in vain, while Sarah watched coldly, not a hint of pain. She zipped him up tight in the suitcase of love. No air, no light, just the stars above. He thought it was a joke, just a lover's embrace. Sarah, he cried in that tight, dark space. Love's a game of risk, a dangerous thing. In the suitcase of love, it's a deadly flame. Sarah's smile fades as the silence grows. In the suitcase of love, nobody knows. Morning came with silence, no breath to be found. Sarah unzipped the case, Jorge's last sound. She stared at the scene. What had she done? In the suitcase of love, there's no place to run. She zipped him up tight in the suitcase of love. No air, no light, just the stars above. He thought it was a joke, just a lover's embrace. Sarah, he cried in that tight, dark space. Love's a game of risk, a dangerous thing. In the suitcase of love, it's a deadly flame. Sarah's smile fades as the silence grows. In the suitcase of love, nobody knows. Love's a game of risk, a dangerous thing. In the suitcase of love, it's a deadly fling. Sarah's smile fades as the silence grows. In the suitcase of love, nobody knows.
Hey, everybody. Good morning, good afternoon, good evening, good night, whoever you are, wherever you are, whatever you're doing, whoever you're doing it with, why you're doing it in the first place, however many times you're going to do it. I don't care. I'm just glad you're doing it here with me. Legal Vices on this little old channel we like to call Legal Vices because I'm clever that way. We're one day closer to the restart of the of the Sarah Boone trial. As many, if not all of you know, it was postponed 1 week due to Hurricane Milton coming right on the heels of another hurricane. They're typhoons over here in Asia, okay? One hurricane right after another, big bad one. The court said, we'll see you next Monday. So we got today. Jury selection is going to start next Monday. Won't be streamed, but likely there'll be motion hearings either on Tuesday or Wednesday, and presumably they will be streamed. And then they'll whittle down the pool of jurors even further to the final ones, and then I would expect two things. One, either opening statements to begin on Thursday or Friday. We'll have to see which one of those is right. I was going to say maybe the judge will just say, let's wait till Monday. But this judge wants to get this particular show on the road. So I think it'll be either Thursday or Friday next week when the opening statements actually begin. But before that, we're going to be doing, I said, the motion hearings and anything else we can think of to keep ourselves entertained and up to date on what's happening with Sarah Boone. So what we're going to be doing today is we're going to be looking at the autopsy report, a motion in limine, some hearing notes, and a motion to exclude. And we're going to find out some interesting stuff that we may have or may not have known. Some of you may know I've only read one of these documents in full and parts of the other ones. So there might be some stuff that I'm going to learn from this, and there might be stuff you already know, but let's figure it out together. And I just want to give a super special right at the beginning shout out to the 312 of you that are just mulling about, waiting for me to get the show on the road here. We have 134 likes. That's like almost 200 of you haven't done your job. Get out there and smash that like button for me if you wouldn't mind. I would just be thrilled and tickled 6 different shades of pink if you were to just slap that like button ever so lightly and make sure you do it an odd number of times. And if you have not subscribed, please do so. We are inching ever closer to that magical number of 81,000. Currently, we are sitting at, drum roll please, exactly 80,840. Thank you so much for all the love you guys have shown as this Sarah Boone trial gets closer and closer and closer. We're exactly 160 subscribers away. 160 subscribers away from 81,000. So let's hit that subscribe button if you haven't already done so. And if you have, just double check to make sure it is still subscribed, because YouTube is asso and sometimes unsubscribes people for no reason whatsoever. So, and once you've done that, after you have hit the like button, after you have made sure you're subscribed, then feel free to come on over to the like and subscribe poll pinned there at the top of the chat and vote. Today, Sarah Boone, favorite quote. These are just a few of the quotes that came to mind when I was making this little poll here. What's your favorite quote of Sarah Boone from this list? I can't get drunk, or I excel at everything I do. It wasn't intentional, or what does sustained mean? All those are things she has actually said at some point at some point from day one until today. So here you go. I was going to say recently, but I realized that some, if not most of those, sort of came on day 2. Right. Just check that. We'll check back in an hour or so. See how you're feeling, what your votes are. Let's kind of organize the stash here. There we go. And of course, we have the official Sarah Boone cocktail, vodka and tang, which we like to call the Boone Tang Suitcase cocktail. So if you're playing along at home and it's a drinking time and you're not driving or doing anything else, please feel free to find yourself some tang. If you only have orange juice or something other orange flavored beverage, just pretend it's tang. That's our official cocktail, Boone Tang Suitcase cocktail. Ooh, all right. Let's see. What's the next thing we need to get off our plate here? I said palate. Get off our plate here before we start in with emotions. Oh yes. 2 last final quick things. One, due to the absolutely overwhelming super awesomeness of everybody in chat yesterday, we made it to day 32 of the emotional support potato pig dog achievement. 32 days in a row we have hit that streak. So there. I see that my dog is chewing on one of my hats. Well, why are we doing that? Let's stop that, okay? Oh, great. Well, I have to de-dog hair my hat. It was a baseball cap with frayed ends, so now it looks cooler. Actually, it's my shit show supervisor. It's my shit show supervisor hat they were snacking on. All right. Well, now let's get back to these 2 things. Day 32 of the emotional support potato pig dog cam. We have unlocked that achievement 32 days in a row. Let's see if we can make it 33. It might be a little tight. This is going to be a shorter show than normal because I have to wake up and do real practicing lawyer things in the morning. It'll be Saturday morning my time, and I have to be all the way across the city and sit in on a board meeting for 6 hours. So it's going to be a little bit shorter today. So if you want to unleash the emotional support potato pig dog cam, get in, get early, and let's do it. But it's entirely up to you. It's we do that through super chats, gifted memberships, purchased memberships, and direct donations to any of the links in the description. It's entirely, we don't beg for it, we don't grift for it, we just mention it and let you decide if you want to keep the streak alive and get us to day 33. And I can't remember what the other thing was. Oh yeah, there was going to be a shorter show because I have to go do law sort of stuff in the morning. Ugh. Oh yes, definitely a board meeting. Ugh. I am so not looking forward to it. I tried to get out of it, but there's no way. Unfortunately, no typhoons came here. It sort of, there was one, but it kind of banked around the outside of Japan. All right. Where should we start? I think we should start at the let's look at the minutes from the most recent hearing, because now I actually have to search for something here. Excuse me while I search for this. I have to go to Court TV real quick. I forgot there's an audio visual component to this. What is wrong with YouTube? Okay, we are getting there. Give me just a quick second whilst I scrolling. Yes. Haha, there we go. And you'll see what I'm doing here in just a quick second. All righty. Good. We are good to go. Apologies for that. And right. I've got to rearrange all of my winders. Okay. First things first. The presentation of the screen, which is right here. We'll get there eventually. Don't pressure me. I'm old. Right. These are the minutes from the hearing on October 10th. I'm sorry. That's her birthday. It was her birthday yesterday. We sang happy birthday. We sang happy birthday to Sarah yesterday. So if you were here, you participated. This is the most recent hearing. Right. In the circuit court of the 9th Judicial Circuit in and for Orange County, Florida, Sarah Boone, defendant, birthday yesterday, 10/10/1977. This cause coming on this day for trial with Assistant State Attorney D. Cacciatore and William J. present, and you, the defendant, Sarah Boone, being now present and represented by David Vare Winston Hobson. Winston Hobson gets a name twice. How he must be extra special. Rachel Fugit, James Owens, Kevin Beck, Tony Henderson. Holy cow. Present and Tony Henderson. Wow, she actually has more than 3 lawyers. I thought she had 3 lawyers. She's got what we call a mess of lawyers. Count 1, second-degree murder, first-degree punishable by life. Court orders, court minutes per the court. Defense to provide order to allow defendant to wear dress shoes. Whew, good thing she gets to wear dress shoes. The judge is like, all right, I'll give you that motion. We're going to rule against just about every other motion you have, but I'll give you the win on letting her wear dress shoes. State placed officer on the record that they took the testimony of the investigating officer. Defendant rejected offer. I'm sure we all, most of you have heard that she rejected a plea agreement. She rejected a settlement offer. She rejected a plea offer. She just rejected it. And jury selection postponed until 10/14/2024 at 9 a.m. So it's going to start a little bit earlier, but it's not going to be streamed, so what do we care? Done, ordered, and filed in open court on October 7, 2024. Honorable Judge Michael S. Kranick. Now, because we haven't watched it yet, and that's what we're doing, we're catching up on these things, we are going to watch her reject her plea offer. And where is the rejecting a plea offer screen? There it is. So we have to stop that screen, and then we have to bring up the rejecting plea deal screen. And ladies and gentlemen, this is crazy to me, but this went down.
Trial has been postponed. Many more to hit. So
selection in this. Due to the potential storm and the ramifications of it, the court is going to postpone jury selection in this matter till Monday, October 14th at 9 a.m.
So we have a huge crew here from Court TV on the ground, Julia. Then things would have been more or less.
She was given a 15-year plea offer.
Over for Sarah Boone in regards to what the impending trial was going to be.
Proceed to trial in this.
That. Let's go ahead and listen to some sound from this morning regarding that plea offer.
Do you understand that if we were to proceed to trial in this matter, and if you were found guilty, the lowest permissible sentence that the court could levy in this case would be 22.5 years in the Department of Corrections? Do you understand that? Do you understand the state's offer to resolve this case? Okay.
Now, there are those of you that just think she has to be in control or whatnot. But hearing this offer, knowing that if she is convicted, the minimum time she will spend behind bars is 22 and a half years. The maximum time she'll spend behind bars is life. 22 and a half years to life. That's what she's facing if she's found guilty. Knowing all of this, they offer her 15 years. The only rationale that I can possibly conceive of why she would say no to that is she truly and honestly believes she will be found not guilty if she is just allowed to tell her side of the story. I mean, if she was trying to play 4D chess and she knew she had a terrible case, she knew she would have very difficult odds of winning, if any, this is not the time to take a roll of the dice. This is when you go, all right, look, and it's even sweeter than this. The deal is even sweeter than just the straight up 15 years. But she's already being offered 7 years less than the minimum sentence she is going to face if she's found guilty. So she must think her case is so good that she honestly believes she's just got to explain it and they'll understand. But let's hear how sweet this deal really was.
The offers 15 years to a lesser included charge of manslaughter, with the understanding that she would serve 85% of that sentence.
Okay, this is how sweet that deal was. She would not go through the rest of her life having to check off a box somewhere that I have been convicted of second-degree murder. They would plea down to the lesser included offense of manslaughter. She would get a manslaughter conviction. They would give her a 15-year deal. And he just said she would serve 85% of that. That's a little over 12 years. We'll just say it's 12 years. So they offer her 15. She serves 12. She's already served 4.5. She accepts the deal. She gets a manslaughter conviction. 7.5 years from now, she walks out of prison a free woman. 7.5 years from now, she would walk scot-free away from prison. But rather than taking this offer and serving 7.5 more years, she is gambling that she will face life in prison, or a minimum, a bare minimum of 22.5, which would be 18 more years at a bare minimum. Assuming I'm putting myself in Sarah Boone's case, putting myself in her shoes. Let's say I was innocent and it really was just a horrible, stupid thing gone wrong. It was a horrible, stupid thing gone wrong. And I was trying to tell them it wasn't intentional. Just, it was a weird kink thing or it was something else. But I felt that I was truly innocent. If they came to me with this deal, and if I had her evidence, I'd be going, I am intercoursed. I am well and truly intercoursed because I see how horrible this evidence makes my case look. I'm really, really screwed because I don't have any good evidence to support my position. I know I'm innocent, but it looks horrible. I would take this deal. I would take this damn deal, even if I was straight up innocent. I would not risk a jury with the facts of this case. So the only thing I can think of is that she honestly and truly believes, one, she is innocent, and two, if she's just given the chance, she'll be able to explain it to the jury and they will understand and let her go. That is the only rationale that I can possibly conceive of. Maybe I'm wrong, but this makes no sense that she would reject this plea. Let's hear it out.
That's up to the department and her behavior, but that is my understanding of the section.
Ma'am, understanding the state's offer, do you wish to accept or reject the state's offer to resolve this case?
Reject.
There you go. Reject. I don't understand it, but that's what she did. It's baffling. But thank you, Sarah. If she pleads out or something, because I don't think they're going to offer it. I do not think they're going to make this offer again. This is the second offer she's turned down. The second manslaughter plea offer she's turned down. So why would they offer it again? Especially this close to trial. They offered it right before. Now they're like, all right, you want to play ball? Let's play ball. As far as I know, no, the offer's not on. They make the offer and then she rejected it. And so the judge's like, all right, let's go to trial. And I'm sure that had something to do with the shouting match that was reported in her daily behavior logs. Excuse me. I'm sure her lawyer was trying to talk some sense into her and failed. So that's what we have to work with. Now, if we go back to day one, the day of the incident, she, as far as we know, she wakes up, whatever time it is. She said morning, then she said noon, then she said 12:30. She woke up at some point, late morning, early afternoon. She allegedly sees her boyfriend just goes, oh my God, I accidentally fell asleep and I didn't know what to do. She calls her husband, her ex-husband. They finally get a hold of each other. He comes over and walks in, sees some legs in the entryway and goes, ooh, yeah, I'm out. And he walks out and says, you call 911. I'll be out here in the parking lot. The law shows up. The lawman shows up. Well, it was actually a lawman and several law women show up and they start the questioning, what's going on. And then they later did a separate investigation, a separate interrogation or questioning in the officer's police car or sheriff's. I believe they're sheriffs. And I know, as I said, for some reason, sheriffs get upset when you call them police. The lawman. She interviewed Sarah Boone in her car and then called her in the next day. Come on in, and that was the interrogation video that we've watched previously. Now, what happened between questioning in the car number 1 and station questioning number 2 was the autopsy was performed. Yeah, so the police had the had the autopsy. I'm just going to call them police. They had the autopsy to look at before they questioned her. And speaking of awesome things to do, Kim Dodds is a new member. Kim Dodds, if you're here, this was earlier today. This was about 10 hours ago. Kim Dodds, welcome to the Clean and Sober crew if you are here. And Lowlands Angie has been a member for 1 year. Thank you so much for being here for 1 year. You are awesome. Yeej, 1 year. Vices going for at least one more. Let's do it. Don't go anywhere. I'll be here. You be here. We'll both be here. Matilda. Thank you so much. Good afternoon from the Netherlands and good evening to you from Korea, as always. I hope you are having an amazing day. Thank you for kicking us off with the first of the super chats as we move down the road towards unleashing the emotional support pig dogs for the 33rd day in a row. And Squid Pro Quo, with a $5 to get things started. Sorry, couldn't be more. It's not required. It's not begged for. It's not expected. You know, if you can't afford, don't. If you can, do. And whatever it is, anything. I am greatly humbled and grateful and graciously accept anything that comes my way. And I graciously accept when nothing comes my way, but you are all entertained in chat. So yeah, nobody should be out of anything, giving super chats and memberships and whatnot. But thank you very much, Squid Pro Quo. Hurricane Helen ruined the budget. Only got $750 from FEMA. Yeah, it's kind of ridiculous, isn't it? But thank you so much. Kathy, oh my Lord in heaven, Kathy Michael gifted 10 Legal Vices memberships. Woo, you get a big foghorn for that one. Thank you so much for gifting those 10 Legal Vices memberships. And there seems to be a little bit of a membership war going on here. And Kathy Michael has also become a new member. Kathy has joined up the where is your membership? The Clean and Sober crew. Thank you very, very much. Not to be outdone, Aussie Wombat drops 5 Legal Vices memberships. Feeling the Challenge, Ray Gun Moo drops 5 Legal Vices memberships. Adair, feeling left out of the Griftathon game of membership donations, gifted 5 Legal Vices memberships. This is to all of you. If any of you got one of these 10, 20, 25 memberships that have been gifted so far, make sure you give everybody a super special thanks. I'm not sure who got what because there was just too many coming fast and furious. Linda Bradford has also just joined the Clean and Sober crew. How awesome is that? We are well into all of the excitement and festivities this evening. Wow. Again, off to a super good start. And we have already, without even doing anything but reading one short document and looking at one short video, we have already reached that part of the show which we like to call Release the Hounds. That's right. We have got to release the hounds with the 33rd day in a row of unleashing the emotional support potato pig dogs. We have Strawberry, our main guest of the evening, and we have Yoda over there in the corner. We'll focus here on Strawberry for a bit. She likes to be mobile. Thank you so much. And Hey Joe has just dropped a sticker of a suitcase. Oh, nice. I get it. Thank you so much, Hey Joe, for dropping the sticker. All right. Thanks, guys. We can get rid of this outdated 32-day business. We are already on day 33 of the emotional support potato pig dog cams. So let's banish this away, and we'll see if we can get to day 34 tomorrow. Or on Monday, anyway. Seriously, people, bless you. Bless you all. You guys rock. And we're going to get back. We're going to read the autopsy report now. Thank you so much. When we read this autopsy report, we're going to start a fairly reading heavy remainder of the show. which means I'm not going to be able to pay as close as attention as I normally would to chat. But I will look up every now and then, scroll up a little bit, see what I've missed. Maybe has been a member for 3 months. To know who's been giving me these memberships, but 3 months and I've paid for none of them. Thank you all. That's the goal. That's the goal, is to banish the gray from chat. Give everybody colors. Banish the gray. Away with the gray. Put the gray in the suitcase. We all need colors. Scott Anderson over on Rumble says, why put yourself in her shoes when you can put yourself in her suitcase? Well, because I can live if I'm in her shoes. All right. Ladies and gentlemen, dogs, thanks, guys. Malin Lindstedt says, tell us about your hat. This is a lovely, super nice summer straw riverboat gambler hat, where from Miller Hats in Houston, Texas, millerhats.com, where I get I get all of the cowboy hats and Western hats from them. That's just my hat go-to place, millerhats.com. I tried to get them to sponsor me when I visited the mothership last summer. I visited the store last summer. I tried to get them to give me a sponsorship. I just got a really blank look from the owner. And I realized they probably don't need my sponsorship, because literally after I said, hey, I've got a bunch of your hats. I think I have like 8 or 9 of their hats. He told me about a guy in Japan that has at least 50 hats from him. And then he literally took a phone call from Stevie Nicks, who was there in concert. And she was saying she was going to come over and buy some hats. So I figure if there's dudes that have way more than me, and freaking Stevie Nicks is calling him on the phone, and Ozzy Overlord Hayden was there. So he can, if he comes in, he can vouch for him being on the phone talking to Stevie Nicks. So he doesn't need my silly little support, but they are great hats. Millerhats.com. That's my go-to hat place. This is the I think it's gunmetal blue or something. I think it was the color. Riverboat gambler hat. It's getting winter. It's almost time to put the straw away. All right, enough of the shenanigans. Let's get into this autopsy, because you remember they have the autopsy, and they had this before they started the second in-station interrogation of her. And there was some interesting facts we learned in there. All right, let's share the screen. And right. Office of the Medical Examiner, District 9. Hey, that was a great movie. I hear they're making a sequel to District 9. 20, there's their office. YouTube doesn't like us reading those things for some reason. Report of autopsy. Decedent, George Torres. Case number, manner of death, homicide. A homicide is just quietly, although we saw it in the previous trial we covered, where they tried to conflate homicide with murder. Different. Absolutely different. Homicide just means somebody got killed. There's justifiable homicides. There's negligent homicides. There's murder is a homicide. So all murders are homicides, but not all homicides are murders. So manner of death was homicide. It means somebody done something to somebody else and they died. Sex, male. Race, white. Okay. All right. Jorge Torres. He's a white man. All right. Whatevs. Date of death. Found February 24th, 2020. Yes, that's a great song. Somebody done somebody wrong song. Cause of death. Oh, this was performed by Sarah Zidowit, D.O., Associate Medical Examiner. Cause of death. Positional asphyxia with environmental suffocation. All right, let's break this down from reverse. Environmental suffocation. You're in an environment where suffocation is possible, i.e. a suitcase. So environmental suffocation. I don't know if putting a plastic bag over someone's head would be considered environmental suffocation, but in an airtight space or a space where breathing is ridiculously difficult, that would be environmental suffocation. So we got the suitcase. Positional asphyxia. That is exactly what it looks like. It's asphyxiation, the inability to breathe due to the position you are in. So, I mean, if you're down here like this long enough with, your windpipe constricted, or I guess a good example of positional asphyxia might be, someone who does something dumb and gets pinned between their car and the floor, the ground, or a fence or something. It's when you're in a position where your lungs can't expand and contract. It's where you can't get breath into your lungs just due to the position you're in. And so curled up inside of a suitcase could be a cause of positional asphyxia. So that's the cause of death. Being in a position where he couldn't breathe for one reason or another in an environment where suffocation occurred. That does not sound like much fun. That sounds like the exact opposite of much fun. No, it was due to his position. You see that you've got to look it down. Positional asphyxia with environmental suffocation. The environmental suffocation is the suitcase part of that. It's his position and being inside a suitcase. So it's a both thing. The final anatomic diagnoses. Let's see how much we can we embiggen this 2 more steps. All right, let's stretch this out a bit. And move that over. There we go. Right. Positional asphyxiation with environmental suffocation. 42-year-old man within closed suitcase for prolonged confinement. So that's the cause of death right there. 42-year-old man within a closed suitcase, prolonged confinement. Now we get into the very interesting things. Remember, the police mentioned scratches on his neck, scratches on his back, and a cut lip and bruising. Those are what they mentioned. But let's look at this. This has more things. Cutaneous contusions, surface bruising, deep muscle contusions. Those are the deep bruises within the muscle. Those come from impact wound. Those are impact damage. You can bump up against a table and get the cutaneous contusions. But deep muscle contusions, those are what happens if, maybe that's a good way of putting it. Cutaneous contusions you get from hitting things. Deep muscle contusions you get from things hitting you. Yeah, so there's something happened to give him deep muscle contusions. And remember, the rumor is he may have been put in the suitcase at the top of the stairs and just all ass rolled down the stairs. There might be something else going on as well. Cutaneous abrasions, scratching on the skin. Preorbital edema. It's like water on the eye. He's got there's shit going on with his eye. He's punched, scratched, kicked, poked, whatever, in his left eye. Galeal and subgaleal hemorrhage. Let's look up a medical word, shall we? The galeal layer is something. I don't care about epicranial aponeurosis. Right. Subgaleal hemorrhage. The subgaleal hemorrhage is an accumulation of blood that forms between your newborn's skull and the skin on their scalp. Ow! So it's like bleeding between the skull and the skin of your head. That's subgaleal hemorrhage. And I'm assuming galeal hemorrhage is like bleeding on the outside of your head. But all right. It's not really telling us what galeal hemorrhage is, but I'm going to assume if subgaleal is under the skin, I'm assuming that galeal is above the skin. So anywho, that's it. It's trauma to the skull is basically, it's like trauma to the head. Whatever you want to call it is trauma to the head. So yeah, rolling down the stairs seems to make sense and fit the injury, but so does being hit with a baseball bat, you know. Squid Bro is like, it's movable. It's actually kind of cool to look at. Okay, I'll take your word for it. And while we're paused here real quick, just want to say shout out to Jonathan Irwin of the $2. So marriage? No. I think I'll give this one a pass. I learned my lesson the first time. Yeah. And 3, intoxication by ethyl alcohol. He was drunk, got the hell beat out of him, either over a long period of time or very quickly, such as being rolled down the stairs. And then he was confined for a prolonged period of time inside a suitcase in a position where he couldn't breathe. Continued. Toxicology analysis. See laboratory report. Right? Okay, fine. Conclusion. In consideration of the circumstances surrounding the death and after examination of the body and review of the toxicology report, it is my opinion that George Torres, a 42-year-old man, died as the result of positional asphyxia with environmental suffocation. The manner of death is classified as a homicide. The autopsy of the body of George Torres is performed pursuant to Florida statute, this statute, by the Associate Medical Examiner, District 9, great movie again, at 9 a.m. on February 25, 2020. And Lindsay Hendricks says, yes, the baseball bat was taken as evidence and she claimed it was a gift for her son, which just makes me sick, but she knew what she did with that. Identification. The body of George Torres is identified by Orange County Sheriff's Office Corporal Taylor using the decedent's Florida identification card. The identification is made on February 24th, 2020 at the scene. Clothing and valuables. At the time of examination, the body is dressed in a black. See, this is what you see on TV when they're walking around with their tape recorder. At the time of examination, the body is dressed in a black short sleeve t-shirt, camouflage cargo shorts, worn with a black leather belt. Or it could be it could be Joan Rivers' red carpet. I'm not sure. And undershorts. The remaining personal effects are inventoried and personally verified. So we know what he was wearing at the time. General statement. The body is that of a well-developed and nourished adult man, compatible with the above stated age. At the time of the exam, his body measures 62 inches. That's 5'2". That is very short. How many centimeters is it? Like 150 centimeters? Convert 5'2" to centimeters. Oh, it's 152 centimeters. So yeah, he's 152 centimeters, 5'2", 62 inches, and weighs 103 pounds. That's, I believe, about, we'll call it 45 kilos. Convert 103 pounds to kilos. 46 kilograms. So he's 46 kilograms. He weighs 103 pounds. BMI is 19. He was a small dude, a really small dude. The body is ambient temperature. That's saying he has achieved room temperature. Rigor mortis has receded. When we think of like people and going to rigor mortis and being all stiff after death, it takes 6 to 8 hours for that to happen. And then after another 6 or 8 hours, it starts to go away and the body gets soft again. So he's been in that condition for quite a while. The livor mortis is fixed, posterior, and rises to the level of the posterior axillary lines. So basically all the blood has pooled at the bottom of his body on his left side. Fixed lividity also involves the left side of the torso and the left upper extremity in the lateral aspects. The body is neither decomposed nor embalmed. And before we get into the external examination, Janice Wingfield has just dropped a $10 super chat. I wish they had done a BAC on Sarah too. I have a feeling she was blackout drunk AF. She certainly sounded like she'd had more than half a bottle of wine in that video that she made on her phone. And wait, did we have a Steve Gosney sighting here in chat? I believe I saw a Steve Gosney sighting. Hey, Steve, if you're there, welcome. Long time no see, my friend. General statement. Oh, we already read that. External examination. The scalp hair is black, straight, has a normal hairline, and measures an estimated 3 centimeters in maximal length. Facial hair consists of a black mustache and a black beard, which is confined to the chin. It rides, the irides are brown, the pupils have equal diameters. The cornea are slightly clouded and have horizontal bands of darkening. The conjunctivae are congested. The sclera are white. Oh, she's really looking at his eyes here. The sclera are white and have focal hemorrhage in the superior aspects. So burst some blood vessels in his eyes as well. The left sclera has lateral hemorrhaging. So yeah, there's more severe hemorrhaging in the left eye. The external nares contain a small amount of mucus mixed with bloody fluid. The nasal skeleton is palpably intact. It's palpably intact. So doesn't have a broken nose. Hey, there he is. There's Mr. Gauze. There's the Gauze man. What's up? So he doesn't have a broken nose. The nasal skeleton is not just intact, it's palpably intact. The lips have recent injuries as described below. The oral cavity has natural dentition in a fair to poor state of repair. He's got his teeth, but they're not in that great of they're okay to really bad condition. The oral mucosa has intact frenula and no petechial hemorrhages in the oral vestibule. The phlegm in his mouth is okay, and apparently there is no bleeding inside the mouth. It is lined with blood-streaked mucus. Ugh. The external auditory canals, those are his ears. The external auditory canals are free of foreign material. Oh, see, you got to sound important. You got to sound intelligent. You can't just say ears. You have to say the external auditory canals. Because there's different parts of the ear, I guess. The neck is symmetrical and has no palpable masses. All right, that's good. The thorax is well developed and symmetrical. The abdomen is scaphoid and soft and has no palpable masses. Okay, so we're good there. The external genitalia are those of a normally developed adult circumcised man with no injuries. The testes are descended into the scrotal sac and are palpably unremarkable. Well, shit. If I'm ever dead and they're staring at my junk, I would be disappointed if they just said palpably unremarkable. I'd be dead. There's not much I could do about it other than haunt her office for a while, but just something a little sad about having a doctor look at your junk and call it palpably unremarkable. The lower extremities are symmetrical and have no anatomic abnormalities. His legs look normal. The arms, forearms, wrists, and hands have no anatomic abnormalities, as are his arms, hands, and wrists. The fingernails are intact bilaterally. The back is unremarkable except as indicated. Scars and tattoos. Scars, that's where a doctor would need a separate piece of paper to document all of my scars. It would be C reverse side or C separate attachment. I've got scars all over my damn body. Now, the lateral aspect of the right arm has a gray tone tattoo of a character face. The dorsal aspect of the right forearm has gray tone tattoos of letters arranged in a vertical fashion. The lateral aspect of the right leg has a gray tone tattoo of indeterminate design. I have 0 tattoos. But again, if I had a tattoo and someone was trying to identify it and they said indeterminate design, that's a good way of saying, it's a bad tattoo. Can't tell what it is. The right side of the neck has a gray tone tattoo of multiple letters. The posterior aspect of the right leg has a gray tone tattoo of a female figure. The body has no apparent remote surgical scars. I've got lots of surgery scars. Positional asphyxia with environmental suffocation. Let's hear a little bit more about that, shall we? Per investigative reports, the decedent had climbed into a suitcase, which was subsequently zippered closed. He remained in the suitcase for up to 11 hours or more, per report. Additionally, review of cellular phone video recording revealed the decedent stating that he was not able to breathe while in the suitcase. Yeah. So that's what we knew. Now this is the new part of it. The blunt impact injuries. The lateral aspect of the left upper eyelid has a purple-blue, we'll call it bruise, and is associated with a small amount of subcutaneous edema fluid. The mucosal surface of the lower lip has a few contusions and lacerations. So his eye is jacked up, his lower lip is jacked up. A few contusions and lacerations. There's more than one cut in his lip. Christian Perkins, did you read the state's motion in limine? That will be coming up next. That's the very next document we're going to read. We have not read it yet. That's next. All right. So he's got his eyes jacked up. He's got more than one laceration and more than one bruise on his lips. Ugh. The left temporoparietal region of the scalp has glial and subglial hemorrhage estimated at less than 20 cc's. So less than 20 cc's of head wound, of blood, I guess, between his scalp and his skull. The right side of the face, near the corner of the mouth, has a crescent-shaped red-purple abrasion. A little scratch over there, too. The right side of the neck, in the supraclavicular region, has a few scattered red-brown linear abrasions. Fingernail-like. That's how I read that. Linear abrasions. Like, meow. Oh, he weighed a lot less than Sarah. Yeah, I would guess. She looks like she's much bigger than him. So he's got all these problems with his face and shoulder. The mid-upper back has a series of obliquely oriented linear abrasions, each with a width of 0.3 centimeters and lengths of 7, 12, 15, and 6 centimeters left to right, respectively. Again, it sounds like she just scratched the hell out of his back. The left side of the back, near the posterior axillary fold and extending medially, is a series of punctate purple-blue contusions, a series of bruises on his back. The above-described contusions involve the underlying adipose tissue and skeletal muscle and are associated with intramuscular edema. The sacral area of the back and the posterior midline has an 8 by 6 centimeter zone of red purple ecchymosis. So in the middle of his back, there's a pretty big bruise, it sounds like. The dorsum of the left hand, it's the back of the left hand, has blue-purple ecchymosis overlying the metacarpals and second digit. Oh, so he's got bruising on this part of his left hand. Okay, overlying the metatarsal area and near the base of the thumb. So, again, this area here is bruised. The posterior aspect of the right arm near the elbow joint has a 4.5 by 4 centimeter compressed dry red abrasion. Think 2 inches by 2 inches. It's a little smaller than that, but that's a good reference. About a 2 by 2 compressed dry red abrasion. The lateral aspect of the left arm has 2 vertically oriented red-brown linear abrasions, measuring 3 centimeters and 8 centimeters in length, medial to lateral, respectively. Again, scratching on his arm. This dude has been beat to hell. He literally has scratching on his back, his front, his face, his shoulders. He's got bruising everywhere. I'm starting to have a different view of this. I really am. I don't know how you get those marks, those scratch marks being rolled down the stairs. Well, let's continue with the internal examination. The usual Y-shaped incision is made. That's where if you've seen the if you've seen the autopsy things in movies, it's like a Y shape down the middle of the chest and then up to the shoulders. So they did the Y cut on his body. The Y-shaped incision is made and reveals no evidence of extravasated blood in the subcutaneous tissues of the chest or abdomen. No internal bleeding in the chest or abdomen. The serosal cavities have no adhesion or abnormal collections of fluids. The pneumothorax test is negative for gas bilaterally. The organs are congested in the expected anatomic positions and have no decomposition. So that's good. All of his organs are where they should have been. That's a good sign. The cardiovascular system. The aorta has a few cholesterol streaks, but no real arteriosclerosis. The vena cava and their major. Okay, this is what it would be kind of cool, just like poking through people's bodies and like slicing up the heart and looking for things. But where are we at here? The vena cava and their major tributaries return to the heart in the usual distribution and are unremarkable, with no thrombosis. The pulmonary trunk and pulmonary arteries are patent. They have no thrombomobile and have smooth intimal surfaces. The large vessels are not distended and contain partially clotted dark red blood. So aside from a little cholesterol streaks, his heart seemed to be unremarkable, normal, and good to go. And speaking of good to go, John Gordon, member for 15 months. Thank you so much for the approaching year and a half of support. Thank you. And remember, she still didn't take the plea deal. Correct. So she most certainly did not take the plea deal. Yoink. All right. The heart weighs 260 grams, quarter pound. That'd be about a half pound, wouldn't it? Yeah, a half a pound. The epicardial surface is smooth. The coronary arteries arise normally, have patent orifices, and follow a right dominant distribution. The proximal third of the left anterior descending coronary artery has a greater than 75% narrowing of its lumen due to eccentrically placed firm yellow-white fibrolipid plaque. Wow, all right. That's concerning. His left anterior coronary artery seems to have been 75% narrowed. The remaining epicardial arteries are of normal caliber and entirely patent. The myocardial cut surfaces are firm, brown-red, and have no discernible lesions. The parietal and valvular endocardium is smooth, thin, and unremarkable. Hope it's not the vulva rings. That would be weird finding those inside of a man's chest, wouldn't it? Not the vulva rings, the valvular rings. Awkward. The valvular rings, leaflets, and cusps are normal. The atrial and ventricular septa are intact. The chambers of the heart are not chronically dilated. I know we've got nurses. Here in chat. So nurses, please feel free to offer your thoughts and opinions on this as we go along. Yes, Lindsay, you are correct. Lindsay Hendrick points out scratch marks are certainly interesting because in the interrogation right there at the end of the sheriff's office interrogation, they actually asked to check for DNA under her fingernails, and you can see if she's kind of trying to clean them before she does it. She kind of does look like she's trying to work out from underneath the fingernail. So, yeah. And it'll be interesting to see what they found as well. Aside from his coronary artery being clogged, his heart was fine. Lol. Yeah, and seeing as how it was the valvular rings and not the vulva rings that were found in his chest, that's also a relief. Respiratory system. The upper and lower airways are patent and lined with clear mucus, as they should be. The distal bronchial tree contains a small amount of froth. Froth in the lungs is not a good thing. The mucosal surfaces and yellow red smooth and have no whatever that is. I just got stumped by a word. The right and left lungs weigh 620 and 560 grams respectively. They have smooth pleural surfaces. Much anthracotic pigment is deposited in the subpleural lymphatics of all lobes. The cut surfaces of the pulmonary parenchyma are variegated red to purple, mildly congested, have prominent green tobacco staining. He's a smoker. And tattered tissue loss in the centrolobular distribution. The peripheral pulmonary arteries have smooth, intimal surfaces and no thromboemboli. Petechiae, tiny points, burst capillaries. Petechiae, that sounds like that movie Nell with Jodie Foster. Tay in the wind. Petechiae. It's the petechiae in the wind. Sorry, old movie reference there from Jodie Foster and Liam Neeson in Nell. He had green stains from tobacco in the lungs. Right. Wow. We've got all kinds of medical terms today, don't we? Woohoo. All right. Let's just do it. We've gone this far. Let's continue with the obscure medical terminology for 400, please, Alex. Hepatobiliary system. Okay. Hepatobiliary system. All right. The liver. Okay. The liver. The liver weighs 1,090 grams, 2.24 pounds-ish, and has a smooth, intact capsule. The liver is firm, brown, congested, and has no lesions. The gallbladder contains viscid green-brown bile without gallstones. Gallbladder intact and healthy. Its mucosa is velvety. Ooh. All right. She needs some time outside. Its mucosa is velvety and unremarkable. The extrahepatic biliary tree is patent and non-dilated. The pancreas has tan brown, lobulated parenchyma, clear ducts, and no lesions. Scarlett Sullivan, it's probably because you watch good movies and you're young. I watch trash movies and I'm old. It's probably a good thing. You don't you don't get most of my references because they're from really awful movies. The spleen, the reticuloendothelial system, the spleen. The spleen weighs 60 grams and has a smooth, intact capsule. The cut surfaces on the splenic parenchyma are maroon, soft, and have inapparent lymphoid follicles. The regional lymph nodes are not enlarged. The thymus gland is partially fat replaced and has residual tan pink lobulated parenchyma free of lesions. Sounds like the spleen is good to go. And so great. The lymph nodes look okay. Gastrointestinal tract. Ooh, hey, I can get that one out easy. The esophagus is lined by smooth, gray-white mucosa with no lesions. Well, was this mucosa also velvety? The gastric mucosa has the usual Ruggles folds. The stomach lumen contains a measured 100 milliliters of tan red purple fluid, with no identifiable food particles. She had not eaten in a long time. There's no food in her stomach. Yep. So who knows how much she drank, but she drank it on an empty stomach. Okay. Where are we at here? The duodenum has no lesions. The remaining gastrointestinal tract has no major alteration. Oh, that's a him, not a her, by the way. Sorry. Yep, KT, sorry. For some reason, I was imagining we were doing an autopsy of Sarah Boone. Yeah. Let's try that again. He. All right, chat, get it out of your system. Get it out of your system. We know. As I said, I was just having, for some reason, I thought we were all up in Sarah Boone here. So let's, He, however much he had to drink, he didn't have anything to eat. He had an empty stomach. Everybody happy now? Genitourinary system. The right, didn't they just used to call this the endocrine system? The right and left kidneys weigh 100 to 120 grams respectively. They have thin renal capsules that strip with ease. The cortical surfaces are red, brown, and smooth. The cortices are congested, vaguely delineated from the underlying medullary pyramids, and have no lesions. The calyces, pelvis, and uteries are not dilated and have unremarkable lining mucosa. There is no increase in hilar adipose tissues in the kidneys. The urinary bladder contains a measured 150 milliliters of pale urine. Its mucosa is white, tan, and unremarkable. The urethra is unremarkable. Hey. Jonathan Irwin with the $2 says Jeff wants up in Sarah Boone. Well, not the way you mean. Thanks, question mark, for that super chat. All right, moving right along from that little awkward super chat. Let's get back here. The prostate gland has a normal size and monomorphic cut surfaces. The seminal vesicles are unremarkable. So, hey, good for him. He had a good prostate. Oh, well, this is the endocrine system, which I thought the genitourinary system was the endocrine system. Wrongo bongo. The pituitary and adrenal glands have no abnormalities. The thyroid gland is red-purple with uniform granular cut surfaces and no lesions. Right, so let's look at parts of the body that we can all readily identify, shall we? The neck. Okay, I'm familiar with the neck. So, all right, let's look at the neck. YouTube has just now told me now would be a good time to insert ads. Creators earn more money inserting ads the more viewers are watching. Give it a try. No ads while I'm live. Hell no. We currently have 867 people going to medical school right now, and only 490 people like medical school. So make sure you hit that like button as we move on to the more familiar regions of neck and head. So we got 492 likes. Let's get that up to 600 or 700 real quick, shall we? And while we're paused here, may as well just make a little bit of a shout out for some likes. Hit the like button, hit the subscribe button. Let's see how we're doing. We are inching our way towards 81,000 subscribers, people. We need to get there by the end of this trial. We currently have 80,856. 144 subscribers is all it takes to get us to 81,000. I'm sure there's 140 of you watching that haven't subscribed. I'm sure of it. So just get down there and do that like. Just hit that like button, hit the subscribe button. Let's get us to 81,000 subscribers by tonight. We can all celebrate together. And take our like and subscribe poll. Let's see how we're doing here. The favorite Sarah Boone quote. So far, 16% of you say, "What does sustained mean?" Yeah, that was back when she was acting as her own lawyer. An objection was sustained, and she says, "Pardon me if this is a dumb question," or something like that. But what does sustained mean? I'm so glad she's got a lawyer. Several lawyers, actually. 22% liked the quote, "I can't get drunk." 30% liked the quote, it wasn't intentional." And in the number one position in the like and subscribe poll at this moment, with 32% of the vote, is "I excel at everything I do." Except for represent yourself in court. But yeah, so that's the like and subscribe poll. Just a little reminder to do the like and subscribe thing. We're halfway through our Boone Tang suitcase cocktail. Just vodka and Tang. All righty, that's the end of the midstream grift. Like, subscribe, take the poll, and make sure you subscribe. Let's get to 81,000. All right, now let's go check out his neck. I understand neck and head, so that's good. The cervical spine, laryngeal cartilages, and hyoid bone have hyoid bone. That is weirdly difficult to say. Hyoid bone have no fractures or other abnormalities. Okay, so his throat isn't crushed, the bone isn't fractured. The strap muscles of the neck are unremarkable. The tongue is normal with no hemorrhages, bite marks, or other lesions. The epiglottic and laryngeal mucosa have no tae in the wind, petechiae, or edema, and no burst capillaries or edema, and is lined with clear mucus. Head. That's this part of the body. The glial aponeurosis has recent injuries as described above. The vault, Sarah's vault may be empty. But let's see, what do you know about George's vault? The vault and base of the skull have no fractures. Okay. So skull seems to be intact. There are no epidural or subdural hemorrhages. The dura mater and falx cerebri are intact. The brain weighs 1,410 grams and has symmetrical cerebral hemispheres. Well, that's good. The external surfaces of the brain are not edematous, so there's no water on the brain. The arachnoid membrane. We got spider membrane in our head? That sucks. I hate spiders. I didn't know we had an arachnoid membrane. I guess we do. Is thin and delicate and mildly congested arachnoid vessels. The cerebrospinal fluid is clear. The cerebral arteries distribute normally and have no arteriosclerosis or other abnormalities. The cranial nerves distribute normally and have no nodules. The external and cut surfaces of the cerebral hemispheres, brainstem, and cerebellum reveal no structural lesions. The cerebral ventricles have a normal caliber and shape. So the noggin's doing pretty good, although there's some abrasions and under the scalp bleeding. Muscular. All right, let's read the super chat. Booty Berries makes me laugh. Lone Star Living, how you doing? Lone Star Living, not kinky time if no bite marks on the neck or tongue. Yeah, exactly. Buddha Berries with the Aussie $2. Potikii. That must be the Australian pronunciation, because we have potikie. Someone else said, but anyway, it's a medical term. Thank you very much, Buddha Berries. Appreciate that. We've decided it just means burst capillaries. At least that's what I got out of the chat discussion. But we're almost done with the autopsy report. Then we can get onto the legal documents, which I actually understand. So hang tight, 878 concurrent viewers. We're going to get off into the motion in limine and a motion to exclude battered spouse evidence, where we learn about other things that may have happened that night. Musculoskeletal system. The clavicles, sternum, spine, ribs, and pelvis have no recent fractures. The musculature is normally developed. Whew, God, we got through that. Toxicology report. Ethanol, acetone, methanol, isopropanol, alcohol. No, he hasn't been drinking rubbing alcohol. That's good. Thank God for that. It looks like his BAC was about 0.01. Not too bad. Of course, he had a lot of time to let it process in that suitcase. Ugh. Analysis by gas chromatography. Sorry. Our office uses gas chromatography to identify oil in oil spills. Headspace injection, blood drug screen, BDSME, specimen type. He has caffeine, nicotine metabolite. So he's got some caffeine and smokes in him. Cool. No amphetamines, no barbiturates, no benzodiazepines, no buprenorphine. Have no idea what that is. No cannabinoids, no cocaine metabolite, no fentanyl, and no opiates. Drug-free. Good for you. That you lived a good life, George. Volatile panel. Vitreous volpi. More. Okay. Same thing. Urea, nitrin, creatinine, sodium, potassium, chloride, glucose. Right. Abnormal reaction profile. Although the incidence of this occurrence is rare, glucose results from these patients should be interpreted with caution. All right. Specimens were intact upon receipt. Chain of custody, specimen security, and integrity has been maintained. Testing has been performed as requested. Whoo, sweet baby Jeebus. That was a report to get through, wasn't it? Holy cow. But we did, and probably understood a good 75% of that. I'm kind of proud of myself. so there we go. Thank you, people, for bearing with me on that and figuring out a little bit more of what was going on outside and inside George. Now, I guess what we need, we should bring up the previous motion in limine, so we can see what the defense was asking to have removed. Give me a quick second here. Bring up Sarah Boone file. Open sesame. Argy, what do you want? What do you want, Argy? I can't play with you. I'm in the middle of doing work. I'm earning money to feed you, dog. Just bear with me, pig. We'll be there. We got about another 30, 45 minutes. Motion in limine. Where are you? I believe this is it. I believe this is it. Hang on. Yes, this is it. All right. We will very quickly look here at what he was asking to have motion in limine. The defense was talking about limiting things from her interrogation at the police station. And there was this whole big deal about the next door neighbors, them. Yes. What do you have to say for yourself, dog? Huh? Are you going to keep doing that? Are you going to keep doing that? All right. All right. Sorry about that. Strawberry is being moody. Doggy wants pets. All right. So there was this whole big conversation from page 69 through 71, where it was talking about the next door neighbors, how the neighbors piss her off because they come over and talk to her sometimes, and they're illegals, and they do stuff in the kitchen. They let her in, something about the bathroom. They wouldn't let her use the bathroom. She understands that. Yes, Benny next door. She's not a nice person. So they wanted this excluded just because it's irrelevant to anything. So they wanted this removed because of irrelevance. Now, these are also the second section that they want excluded. They wanted these particular things redacted from the video. The detective saying, well, he's dead as a result of your actions. The other detective saying, he's dead as a result of your actions. And Sarah Boone replying, I understand that. Yeah. She said that. She's like, well, he's dead as a result of your actions. I understand that, but it wasn't intentional. They want page 55 removed. I have just one last question. You realize you're the person that killed him, right? And her saying, I thought about that. And then later on page 92, well, intention or not, George is dead. You act like when you say unintentionally, that absolves you from everything. Those are the things they wanted removed. Did Jeff refresh his supply of doggo treats? I did. I actually just bought more dog treats today. All right, so that's what they want redacted. And let's look at what the state's response to those requests for redaction are. How are we doing on size? Is this big enough for you people? That's too big for you. There we go. We'll just leave it here. Maybe we can scrunch it up and make it bigger that way. There we go. Right. State's response to defendant's motion in limine regarding defendant's February 25, 2020 statement. And before we get to that, let's give a super special thanks to Parsons 1122 1122. Dog needs a treat. Dog will get a treat. What are you chewing on, dog? What on earth are you? Oh, she's chewing on the inappropriately shaped red dog toy. Dog needs a treat. Dog will get a treat after we finish. I promised everybody. Chloe Albert's Revenge, been a member for 5 months. Sarah contends George was killed by death. That was a great movie. If you haven't seen it, Murder by Death. That was a great movie. All right. The state does not object to the defendant's request regarding pages 69 to 71. That was the irrelevant arguments about the neighbors not liking anybody. But the state does object to the defendant's request regarding pages 53, 55, 56, and 92. That was all of these statements about you realize you killed him. He's dead as a result of your actions. Well-intentioned or not, George is dead. You act like when you say unintentional, that absolves you of everything. They object to that being redacted. Why? The statements are designed to elicit responses from the defendant, and they did. Yeah, they said those for shock value and to get her to say something, and boy, did she talk. Yeah, so I really like that sentence. The statements are designed to elicit responses from the defendant, and they did. They are not statements regarding the law or an ultimate issue of fact for the jury. At issue is whether the death was an accident, as she continually insists in this case, even as recently as October 1, 2024, not whether she caused his death. Yep. See, that's what happens when you keep shouting, it wasn't intentional. It wasn't intentional. It wasn't intentional. It was an accident. Yeah. But of course, we saw her lawyer say for the first time, oh, no, it wasn't an accident. It was self-defense. It was battered spouse. So now they have this big contradiction we talked about during yesterday's stream where he has to argue that this was a sort of a self-defense act as a result of being an abused spouse, where that was never even mentioned in the interrogation video of the sheriff's office. In fact, she said he's been doing great, going to his meetings. We had a great time. It was a lovely night. We were happy. We were listening to music. We were doing puzzles. We were doing art. Then we played hide and seek, and then I accidentally fell asleep. Nothing about any abuse. Everything about not intentional, not an accident. And I mean, gee, not intentional. It was an accident. It was an accident. And we have this dichotomy where she, in all of her taped interrogations, has said it was an accident. It was unintentional. Where now she has to do this battered spouse thing where the premise is it was intentional. You did it, but you had a reason for doing it. The lawyer's got to kind of find a way around this, and we'll just have to wait for trial to see how he does it. The statements are not okay. We got that here. The defendant can request the court to read Florida Criminal Jury Instruction 2.8, recorded interview, effective law enforcement statements on the defendant. It reads as follows. Okay, we don't want these out, but instead we'll let them read this. You are about to watch a recorded interview that contains opinions and statements by Detectives Kopsel and Lowen to Sarah Boone. The opinions and statements are pertinent only to explain the reactions and responses they elicit. You are not to consider these opinions and statements by the police officer as true, but only to establish the context of Sarah Boone's reactions and responses. I certify that a copy hereof has been furnished to James Sylvan Owens and all these other people at their addresses. Cool. That's the end of that motion. They want the irrelevant stuff out. Cool. Everything else we want in, and in exchange, they can read that little caveat as part of the jury instructions at the time the video is shown. Ooh-wee, now we are into a very, very interesting document. And this will be our final document of the day. Let's see if we can get rid of that. And then we'll wrap this up because we are getting late and I have to be sitting in a stupid board meeting for 6 hours, beginning 8.5 hours from now. Before we get there, though, we need to give another super special shout out to Chloe Albert's Revenge. Accidental self-defense sounds so Sarah, doesn't it? Though it kind of does, doesn't it? It sounds very, very Sarah. Come to think of it. Over on Rumble, we have what up, Vices? Nice to catch you live, buddy. Fight Milk. Play the song and start dancing, Vices. Or is that Naked Snake? Yeah, that's not me. That's Camelot. You got to go to Camelot's channel for that. All right. State's motion in limine to exclude battered spouse syndrome evidence or exclude mention of battered spouse syndrome evidence until the defendant testifies to a justifiable use of deadly force. This is very interesting because as they were talking about at the previous hearing, it's the first time they said, hey, motion in limine that we're going to put on our self-defense by reason of battered woman syndrome. He called it battered spouse syndrome. And it was objected to by the defense saying, look, you argue one side is an accident. You argue the other, it was self-defense. There has been no evidence presented that there was any violence done towards her whatsoever on this occasion. And so that's what they're asking here for. They just don't come out of the gate with this battered spouse syndrome stuff. First, make her testify under oath that there was battery, that there was a justifiable, that she was justified in putting him in that suitcase and leaving him there for 11 hours to die. She needs to testify that there was something to that first before she gets to argue so either get rid of it or make her testify first. Very short magic words here at the beginning. Comes now the state of Florida by and through the undersigned assistant state attorney and states and alleges as follows. Ding, 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 ding. Incense, holy water. Those are the magic legal words to commence this motion. Introduction. The defendant has filed a notice and an amended notice of her intent to rely on battered spouse syndrome evidence in this case. Battered spouse syndrome is not actually a defense to a crime. Okay, that's a strong statement right there. Legal Vices, will they provide tteokbokki at the board meeting? No, but there will be sandwiches and coffee. Battered spouse syndrome is not actually a defense to a crime. The introduction of battered spouse syndrome evidence to support a self-defense theory is not for the purpose of justifying a defendant's misperception of reality or to explain why an unreasonable belief was nonetheless justifiable due to her condition. Rather, the Florida Supreme Court has sanctioned the use of battered spouse syndrome to show why the defendant's actions were reasonable, to show in spite of a reasonable perception of danger from the battering spouse, the battered spouse would remain in the home with her batterer, where she may resort to the exertion of force against him to prevent imminent death or great bodily harm. Very, very basically, he's saying, look, she has to show that her actions were reasonable based on a reasonable belief that there was going to be imminent death or imminent great bodily harm exerted against her. There's some case law cited there and facts. Oh no, that's self-defense. This is a battered spouse defense. They're different. This is one form of self-defense. Self-defense is like, this is happening, I'm defending. This is where someone has remained in the house. Like, in spite of a reasonable perception of danger from the battering spouse, the battered defendant would remain in the home with her batterer. So this is more of a serial battery thing where, you know, they're being battered on a regular basis, but they still stay in the home, where she may resort to force against him to prevent imminent death or great bodily harm. I hope that made sense. Made sense to me. The defendant has presented several accounts of what happened on February 23rd, 2020. She made a 911 call at approximately 1 p.m. on February 24th. She spoke to a patrol duty on body-worn camera shortly thereafter, provided a statement to detectives a few hours later on February 24th, and provided a second statement to detectives on February 25, 2020. Let me take that out there. The defendant retained Dr. Julie Harper as one of her battered spouse syndrome experts in 2020. Over the course of the next several years, Dr. Harper interviewed the defendant about the events on February 23rd, 2020, multiple times. Exhibit A at the hearing on this motion will help Dr. Harper's deposition, which was taken on 1 October 2024. The state would direct the court to pages 35 and all these pages of Dr. Harper's deposition for the defendant's statements about February 23rd, 2020. The state retained Dr. Tanya Werner as its battered spouse syndrome expert. Dr. Werner evaluated defendant on October 2nd, 2024. And Dr. Werner was deposed on October 4th, 2024. Exhibit B at the hearing on this motion will be Dr. Werner's deposition. The state would direct the court to pages 75 to 79 of Dr. Werner's deposition for the defendant's statements about February 23rd, 2020. The state is not asking the court to make any credibility determinations about the defendant's statement to the doctors. That would be for the jury to do. Exactly. In the full context of a cross-examination with the defendant's statements to law enforcement. What the state is asserting is that as a matter of law, what the defendant told the doctors does not entitle her to a self-defense instruction, nor does it entitle her to introduce evidence of prior instances of violence, reputation evidence of the decedent's violence, or battered spouse syndrome evidence to help the jury understand why what she did was objectively reasonable. The defendant told the doctors that because of past violence between her and the decedent, she had a generalized fear every day that the decedent would cause her serious bodily harm or kill her. So she's saying, I just have a general fear that every day I live thinking he's going to off me. Do you remember The Burning Bed with Farrah Fawcett? Yes, the TV movie from, I believe it was the late 70s. Yes, I do remember that. That was a weird question, but yes, I do. However, so yeah, on this particular day, remember there has to be this immediate fear of bodily harm or death. However, on this particular day, the decedent did not take an overt action, even in the slightest. The dead guy, George, did not take an overt action, even in the slightest, that made her believe he would cause her serious bodily harm or death. According to the defendant, when she and the defendant woke up, let's scroll up here. According to the defendant, when she and the decedent woke up, the decedent wanted to drink alcohol. She did not, so in order to distract the decedent, she suggested that they instead clean the defendant's townhome, which they did. At the conclusion of the cleaning, the decedent still wished to consume alcohol, so the two of them began consuming alcohol. The defendant did not want to consume alcohol, but she did so to placate the decedent. The alcohol that they consumed was a Chardonnay bottled by Woodbridge. In order to prevent the decedent from becoming sad or upset, she kept him diverted by smoking cigarettes with him, drinking, enjoying each other's company, perhaps using the dartboard on her porch, and doing arts and crafts and puzzles. Although it apparently would upset the decedent, the defendant suggested he call his daughter, who did not like talking to him when he was drinking, or that he calls his brother to tell his brother that the decedent had dragged the defendant down the stairs the night before. Okay, so either his daughter doesn't like to talk to him on the phone when he was drunk. But why is she telling the cops this? His daughter doesn't like talking to him when he's drinking. So I told him to call his daughter, knowing it would start a fight. Or go ahead, call your brother and tell him you dragged me down the stairs the night before. Why? Having done these playful activities for numerous hours, there came a point where the defendant and decedent were sitting on her couch in the downstairs living room, and the decedent tagged her head and said, "You're it." From past games of hide and seek, the defendant understood this to mean that he wanted to play hide and seek. No, when someone tags your head and says you're it, ma'am, you're playing tag, not hide and seek. And she begrudgingly engaged in this game, as with everything else, to placate the decedent. She ran up to the shower after becoming cold and perhaps some misunderstanding about the rules of hide and seek. They're pretty basic. The rules of hide and seek are, in fact, some of the easiest rules of any game ever created. You go hide somewhere, and I seek you. The end. Occasionally, you'll have the rule where if the hiding person gets back to home base before you see them, they win. But generally, it's just you seek, I hide. It's pretty basic. So she ran up to the shower. After becoming cold and perhaps some misunderstanding about the rules of hide and seek, she left the shower upstairs and returned downstairs to find the decedent placing himself in a suitcase to hide. At the time of his death, the decedent was only 103 pounds and had a BAC of 0.138. That's not even double the legal limit. The defendant saw him doing this and decided to zip the suitcase shut while the decedent was inside it. All right. This is really the first time we've heard a decent explanation of what he was doing in there. He tried to climb into the suitcase and she went, aha, I'm just going to zip it shut. I'm going to zip it shut on the bastard. So the defendant saw him doing this and decided to zip the suitcase shut while the decedent was inside it. They were both laughing, and there was still no animus between them on this day. So they were laughing, and there was no fighting or anything angry going on between the two that day. The defendant states she did not zip it completely shut. The decedent was able to poke a couple of fingers through the gap left by the zipper. And then the decedent, and then ... The decedent, I can make this bigger here. And then ... The decedent said he could not breathe. The decedent obviously got mad about not being able to breathe. Yeah, something about not being able to breathe kind of makes you a little upset and a little feisty. The decedent's getting mad made the defendant get mad. All right. The defendant shook the suitcase. She lost control and the suitcase flipped. This is new. She hit the defendant's fingertips with the wooden baseball bat that was in the room. Yeah. That's a thing right there. She hit the defendant's fingertips. This isn't them hypothesizing. This isn't them extrapolating. This isn't them making it up. This is her explaining this. This is her saying, I hit his fingertips with a wooden baseball bat that was in the room. Well, that would sure as fuck explain some bruising on the back of his hands and on the joints of his fingers if he's being wailed upon while he's with a baseball bat while he's in the suitcase. Yeah, that would sort of make some of these deep muscle tissue bruises make a little more sense. If maybe perhaps there was a little more than just his fingertips whacked with a baseball bat while he was in the suitcase. Yikes. Guys, real quick, no politics, no religion in chat. Come on. This has absolutely nothing to do with any country anywhere else or anything. Let's keep all that out of chat. Come on, people. We're better than that, chat. Let's not derail the chat. We're all self-regulating. Just, be good. All right, back to her beating him with a baseball bat inside the suitcase. She hit the decedent's fingertips with a wooden baseball bat that was in the room. Now, after having committed the independent forcible felonies of aggravated assault, aggravated battery, and the non-forcible felony of false imprisonment, the defendant believed the descendant would kill her. Okay. Yeah. Right. Okay. So what's again, this is Sarah's story. Basically saying after I'm hitting him with the baseball bat and not letting him out, I was afraid that he would kill me. That seems to be what is being said there. I put him in the suitcase. I zipped it in. I wouldn't let him out. I whacked him with a baseball bat. And now I'm scared of him. I'm scared that he's going to kill me when he gets out. Yeah, Sarah, just dig that hole a little deeper. Chloe Albert's revenge for $5. She excels at everything except for the hiding and seeking, right? And not self-snitching and remaining silent. Those are the things she's not really good at. Okay, so now after having committed the independent forcible felonies of aggravated assault, aggravated battery, and the non-forcible felony of false imprisonment, the defendant believed the decedent would kill her. Despite believing the decedent would kill her, the defendant flipped the suitcase over so it was right side up, and she believed the decedent would be able to let himself out. Okay, so I thought he was gonna delete me, so I turned the suitcase over and left him away to get out. Yeah, it doesn't make sense. The defendant's specific intent was for the decedent to feel like what it was like for her to choke and not be able to breathe. That's what she said. This is why on the video, she said, this is what it feels like when you choke me. So she wanted him to feel that way. She intended for him to feel this for 2 minutes and believed he would let himself out. And when that happened, if she died, she died. It's an awful weird thing to say. She did not intend to kill him, and she did not believe that leaving the decedent in the predicament she placed him in would kill him. His death was an accident. Well, let's see what the legal analysis behind those statements are, shall we? Wow. Battered spouse syndrome evidence is inadmissible if the defense is an accident rather than self-defense. We discussed that at length yesterday and a little bit earlier today too. You can't claim battered spouse if you're saying it was an accident, because you have to make it an intentional act to do something rather than it was an accident. The defendant's testimony is that she intentionally zipped the suitcase out of levity and while kidding around with the decedent during a friendly game of hide and seek. Then, when the decedent informed her that he could not breathe, she intentionally decided, out of anger, to make him feel like he's trapped in there for a couple of minutes while she beat and shook the suitcase and hit his hand with a baseball bat. This is aggravated assault, aggravated battery, and false imprisonment. She stated that she flipped the suitcase right side up and saw that the decedent could get 2 fingertips through an opening, and she went upstairs to bed, believing he would be able to get out in a couple of minutes. She had no intention to kill him, no intention to leave him trapped inside the suitcase, and she did not even comprehend that he could die from this. The defendant is thus saying that the decedent's death was an accident, and she is not entitled to an instruction of self-defense or to supplant a self-defense case with reputation evidence, specific instances of past violence, or battered spouse syndrome evidence. Yep, I agree. The defendant's statement that she perpetually lived in a state of fear of the decedent is not sufficient to allow specific acts of past violence or battered spouse syndrome testimony. Quoting from this case, Holland v. State, however, before a defendant may introduce evidence of the victim's character, he must first show that there was an overt act by the victim at or about the time of the incident that reasonably indicated a need for self-defense. So under this case here, under this Florida case, to rely on this battered spouse syndrome testimony, you have to show that on or about the time of the incident that the victim, that George did something, did some sort of overt act, some sort of positive act that indicated a need for self-defense. Which, what's up, doggy? Which he doesn't have, he didn't do. There's quoting these other cases. In this other case, victim hit defendant with a 2-inch wide, 4-foot long stick in the hand, because causing only minor injuries did not justify defendant's use of deadly force. So this was getting hit in the hand by a large piece of wood, didn't justify deadly force. I believe it was a gunshot in that case. Comparing the facts of those cases, it is clear there was not even the slightest overt act by the decedent in this case. So George did nothing, not even the slightest act that would indicate a need for self-defense. Prior to defendant committing aggravated assault, aggravated battery, and false imprisonment, there was no imminent threat from the decedent. There was no imminent threat from George before she committed aggravated assault, aggravated battery, and false imprisonment. And this other case here says you can't just attack somebody as they walk in the front door and slash their throat with a knife because 2 days prior they sent you a threatening text message. I like that comment. That's from this case, State v. Woodson. You can't just attack somebody as they walk in the front door and slash their throat with a knife because 2 days prior they sent you a threatening text message. Again, there has to be something imminent. There has to be something overt that the victim, the victim has done to warrant you using deadly force against them. If this evidence is improperly admitted, this is the evidence of battered spouse syndrome or self-defense or past wrongdoings or behavior of George. If this evidence is improperly admitted, it would be a departure from the essential requirement of the law, which would result in irreparable harm that cannot be corrected by a post-judgment appeal. The state acknowledges that the defendant is entitled to change her story yet again. So if the court does not exclude this evidence now, the defendant should be barred from mentioning battered spouse syndrome evidence until the defendant testifies to something that is a justifiable use of deadly force. Battered spouse syndrome evidence properly excluded until defendant testifies, when that's the only source of information for the defense. It's not improper to exclude expert testimony until the facts are in evidence. Battered spouse syndrome is not available if the defense is accident rather than self-defense. Oh, we've had strawberry out of pocket, have we? Not there. We'll focus on Yoda. Strawberry's behind me, right here. Right here, aren't you, buddy? Give me 15 minutes. We'll give you a snack. There we go. I certify that a copy hereof has been furnished to James Sylvan Owens and all the people at all those addresses. The end. That's the motion to exclude the battered spouse evidence or to make them wait until she has taken the stand and testified to something that would justify that sort of response. And Island with the $5. I can believe she was afraid after she was violent. But can you claim battered spouse if you were the instigator? It seems like he was the battered one. In that case, yeah. The way she outlined it, exactly. We were having fun till I put him in a suitcase and started throwing him around and smashing him with a baseball bat and not letting him out. But that is that. Those are the most recent of the motions that have been filed in this case. We are 1 day away. Friday. Then we got the weekend. Monday, jury selection will resume. And again, from what I understand, from what they've said at 2 hearings ago and what the judge said during the last hearing, it seems to be that he's got about 200 people. They're bringing about 200 potential jurors. They're going to whittle that down, hopefully within 1 day, to 50, to around 50, 40 or 50. It is possible they could get the whole thing done in 1 day, in which case, move along a little bit quicker. But I think the judge was saying if they can get it down to 40 or 50 potential jurors on day 1, then they will tell the jury to come back later. They will hear the motion. They'll hear arguments on this motion and any other motions that are filed. And he'll make his decision on those motions. And once all the motions have been taken care of, they'll call the remaining 40, 50 potential jurors in, and then they will whittle that down to the seated jurors, the 12 jurors plus however many alternates they have, and then they will start the opening statements. So I'm expecting opening statements to begin on Thursday or Friday of next week. Monday, I'm expecting them not to have any streaming because it's jury selection. Tuesday, and maybe Tuesday and Wednesday, they'll have the motions hearing. Probably get it all done in one day. But whatever that is, that will likely be streamed because it's a motion hearing and the jury's not around and they're quite exciting. And then they'll do another day of jury selection. Then we'll go on. So that's what we're looking at next week, as far as I understood what it was that the judge was saying. And so that's kind of it. We'll play it by ear. We'll do something on Monday. I don't know what we'll do on Monday yet. Maybe go. I was thinking about on Monday going back to the very beginning of this case, going back to the original information and complaint that was filed, and look at some of the initial law enforcement documents that were filed in relation to this case. But I'll have to wait and see. We'll just play it by ear, guys. And that is it. We have 843 people watching here, 653 likes. We're only 47 likes away from 700. Just do it. Just get out there and hit that like button, people. Hit the subscribe button too, because right now we have 80,862 subscribers. Thank you so much, all the new subs we've gotten so far today. I'm sure there'll be more coming in later. We are so close to 81,000 subscribers, and it's all because of every one of you awesome people. The Vice Squad, and if you're here in chat right now, whether you subscribe to the channel or a member or whatever, you are a Vice Squad member. Even if you're just sitting here passing through today, Vice Squad is the greatest chat on the entire internet, hands down. And we are 137 subscribers away from 81,000. 137 is all it takes to get me to 81,000. And we are well on our way to that silver play button. Guys, you guys are so awesome. Let me see if there's a place we can send you here for more of your LawTube needs, for more of your legal analysis, for more of your true crime needs. Let's see if there's a place I can send you. Let's see. Right. Go into the studio and check on the redirect options that I have available to me now. Oh my gosh, we just got a few more subscribers. Thank you so much. We're 135 subscribers away. Awesome. Content. Today's live stream. Just bear with me here for 1 second, peeps. And today's show, there we are. Customize, redirect. Lots of mystery science theater. It looks like lead attorney. We haven't redirected to lead attorney in ages. So we're going to send you off to the lead attorney here in just a minute. And when you get over there, make sure you say, "Hey, Legal Vices sent me. I hope you're doing well." Because if any of you know him and didn't know, it was last week or the week before he announced that he has inoperable cancer. It's a Hodgkin's lymphoma. So they gave him what, 5 to 7, I think. So get on over there and give him best wishes. Oh, it looks like AV to the 7th power is with him too. So go on over, say hi to the lead attorney and AV to the 7th power. Looks like they're doing some thug trial. Mods, thank you so much for being here and doing your moddy best as always. Chat, thank you for being super awesome as well. Thank you so much for the great chat. Walked a little close to the line today, just like 2 or 3 of you, but everybody is great. Even those people are super awesome. So take care, everybody. Thank you so much for the super chats, the generous gifting of memberships and purchasing of memberships. We will see you tomorrow to see if we get to day 33. No, today is day 33. We'll see if we get to day 34 of the emotional support potato pig dog cams. Join us tomorrow for day 33 of the streak. Not tomorrow, sorry, Monday. Join us Monday for that. Not tomorrow. Do not come here tomorrow. I will not be here. Take care, people. See you on Monday, same time, 9 a.m. Eastern, 2 p.m. UK. Be there. See ya. Go tell lead attorney and AV to the 7th power that Legal Vices sent you, and you wish them your best. See you. Have a great weekend, everybody. Love each and every one of you. Peace out.